Okay, we'll continue on then with Chapter 2, Health and Wellness. Health information is readily available through electronic and print media. However, people often have difficulty determining which information is helpful and accurate. Since it's so readily available now, and because of your expertise in health, and your patients and family and friends will often ask you, um, what you think about a certain thing, or, what you know about this medication, or, tell me a little bit more about this disease process. If you can help a person remain well, you can reduce how frequently that person may access health care, how often they'll maybe go to the emergency room, which ultimately would reduce healthcare costs. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Sorry, I can't pronounce that. Every person has a different definition of health, and a person who is free of disease may not necessarily be healthy. Health is a state that can be influenced by a person's values, their personality, and their lifestyle. For many people, health is defined by the circumstances that surround their life rather than their actual physical condition. And individual perceptions of health can affect how a person's can be affected, by a person's health beliefs, and it can change as a person ages. For example, the older you get, you may start focusing more on thoughts of preventative care. Health might take more of a priority. You might be seeing yourself aging and feeling the changes of aging, and you may want to slow that process down, as best you can by your behaviors and that kind of thing. Nurses individualize nursing care by considering the whole person and the environment to help the patients reach their health goals. Now, I know we talked in the last PowerPoint about theories and health models. These models are theoretical ways of understanding a concept or an idea. There are several health models, throughout nursing, with people's different ideas on what, how different people behave and how nursing plays a role in a person's life. These models will help us to understand the relationship between health and illness and our patients' attitudes towards health and health practices. The way that a person thinks about health influences their health practice. Health beliefs are a person's ideas, convictions, and attitudes about health and illness. Now, this health belief model has three components. It's the patient's perception of susceptibility to an illness, the patient's perception of the seriousness of the illness, and the likelihood that a patient will take preventative action. The health belief model helps us to understand factors influencing a patient's perceptions, beliefs, and behaviors, and helps us to plan care that will most effectively help the patient maintain or restore health and prevent illness. There's different situations you could think about that, but I know when I was studying this, I thought this kind of falls into what we're seeing now with COVID-19, if you think about it. In dealing with that, the patient's perception of susceptibility, there's different camps out there where, say if it's a person that has a lot of comorbidities like heart disease or diabetes, obesity, that kind of thing, that they're seeing that are more at risk for developing detrimental effects from COVID, for example, they may perceive their susceptibility to catching that much more than, say, a young, healthy teenager, may not think a whole lot about their susceptibility, or, a young person, 20s, 30s that don't have comorbidities. And again, the patient's perception of the seriousness, we're seeing that too. You hear people saying, oh, it's nothing but a strain of the flu, it's not that bad. And then you have other people that are like, yes, it is bad, or they've been in areas where they've seen it affect much more people, or their family, but personally they've been affected more profoundly than maybe someone else. So their perception of how serious it is going to be different than someone who doesn't even know anybody that's gotten it. And then that will help influence the likelihood that they might take preventative action. I mean, if it's hit your family hard and maybe a loved one of yours that's close to you has died from it, you're probably going to take actions to keep you from getting it because you've seen how serious it is. Where someone that maybe doesn't know anybody, doesn't think it's that serious, they may not be as apt to take the recommendations of something that could help them, maybe not be affected by it. I mean, that's just kind of something I was thinking about when I was reading about this. So then there is the health promotion model, and this is a framework that is integrating the perspectives of nursing and behavioral science and the factors that influence health. This focuses on 3 areas: individual characteristics and experiences, behavior-specific cognitions and effect, and then behavioral outcomes. And it's similar to the health belief model as well. Again, an individual's experience will probably affect how they react to something and then what they do about that. This is Maslow's hierarchy of needs. I just stuck that in there. I think I skipped one. Sorry, let's go back. Another model is the holistic model, and this is also known as complementary or alternative medicine model. This model is based on the comprehensive view of the person as a whole being. Holistic health models of nursing promote optimal health by incorporating the participation of the patient in their health state. This might include things like using guided imagery like relaxation and what am I trying to think of the word? Imagining that, like, if you're having something painful going on, being able to put yourself in a place where you're imagining, the beach or something calming, to kind of like take your mind off that. Meditation, that's what I was trying to think of too. This might include meditation, maybe the use of music. Some people, music is used in therapies. Massage, massage has been found to be helpful, like in labor, for example. There are some people that, are able to focus and go through an entire labor with just massage and imagery and meditation and that kind of thing. Therapeutic touch. There's light touching, it's sort of like a massage, but not quite, that can help with like pain relief and that kind of thing. So that's sort of what encompasses the holistic health model. And then the basic human needs model helps us to understand the needs of families and patients and their behaviors and how likely they are to participate in health promotion activities. Basic human needs are the elements that are necessary for survival and health. And of course, different people are going to put greater or lesser emphasis on different needs. That's why it's always important to do a thorough and individualized assessment of these needs for each individual patient. And another way to understand a patient's motivation to achieve optimal health, again, that's to review that Maslow's hierarchy of needs, which is where I had placed that earlier. And it's talking about, and we'll go over it in more detail, but it's listed in like a triangle type situation with your needs that need to be met first here at the base. And as your needs become more specified, or, anyway, you have to meet these first needs before you can move on to the next levels, is basically what I'm trying to say. And again, self-actualization is your last need. Maslow described these levels as the person has to meet the needs of one level before they can move up to the next level. And in this theory, individuals have to meet this lower level needs. That's what I was trying to think of a minute ago, before they're able to satisfy the higher level needs. The lowest levels consist of very basic physiological needs. So like your physiological needs are the base of that pyramid were, oxygen, water, food, sleep, sex. When these needs aren't met, then the affected person will be sick, irritated, complain of pain or discomfort. These feelings motivate the individual to satisfy that need. So, they have to be able to take care of this need before they would worry about this other need. So like the second level on the hierarchy of needs is safety, and that includes establishing stability and consistency. Then they can move on to the third level of love and belonging, which is a desire to belong to groups or belong to someone. The fourth level deals with self-esteem. Self-esteem results from the mastery of a task and also includes the recognition gained from others. And then the highest level is this self-actualization level. And this is the desire to become everything that one is capable of becoming. So individuals at this level are concerned with maximizing that potential. An understanding of this hierarchy of needs can provide us with a framework to meet our patients' needs and prioritize care for these patients. So if you think about it, if a patient is in severe pain, they can't rest, maybe they're running a fever, they're delirious, whatever. That is not a time that you can go in there and talk to them about, is their home safe for discharge? Like, you can't go in there and be talking to them. You've got to meet these primary needs first before they're willing to, or even capable of talking about these other things or thinking about those other things. So, unless their basic needs are met, then the higher levels just aren't even relevant. So we need to, keep that in mind for sure when we're taking care of our patients, or when we're taking care of patients, the one maybe that needs one of these physiological things met might be cared for first before you move on to another one that maybe is ready for discharge teaching or something like that. Quick quiz. According to Maslow's hierarchy of needs, which of these needs would the patient seek to meet first? Self-actualization, physiological security, shelter, or love and belonging? And it would be shelter. They've got to know that they have a place to stay before they can worry about those other things. I'm sorry, I got that together there. I didn't mean to do that. For the past 30 years, Healthy People has established evidence-based objectives. Don't know if you've heard anything about Healthy People 2020, but if you have, this was something established, like I said, 30 years ago to help establish or help achieve high quality, longer lives free of disease, disability, injury, and premature death. These strategies were implemented to try to eliminate health disparities and to create social and physical environments that promote health for all people and promote quality of life, healthy development, and healthy behaviors across the lifespan. These objectives are updated every 10 years to meet a wide range of health needs, encourage collaboration in communities, help individuals make informed health decisions, and measure the impact of prevention activities. Healthy People 2020 included 26 leading health indicators, and then they divided these among 12 topic areas to provide a way to access the health of America in key areas, to encourage collaboration across diverse groups and motivate action for individuals, communities, and the nation. This goal is to improve or make improvements, for each objective by the year 2020. So I gave you the links here. This is for 2020, healthy people, and then this is the link for 2030. And it's very interesting. If you go in and look at those, it'll have a list there of like, there's so many things. Like one of the Healthy 2020 objectives was like food deserts. And that's like areas of the country that there aren't a lot of variety for foods, or maybe not as much access to different, say, grocery stores or something. You may live in an area where maybe there's only one store to choose from, or two, and there's not a wide variety of different types of foods there, and that might be considered like a food desert area. Or one of the objectives was like schools, and overweight children was one of the categories, where it was telling of ways to address the fact that we had a high percentage of overweight children. And it would give percentages, and it'd say at what rate, what percentage of kids overweight will we see by 2030? And we want to implement these things. And it was like healthy lunches, and that's when like a lot of the school lunches changed, what they provided for kids to eat and things like that, in order to try to meet those objectives. So there's just a whole list of them. There's women's health issues. There's it's very interesting to go look at. And like I said, they've come out now with some new goals, because we've actually hit 2020, to see what type of things we want to accomplish by 2030. But a lot of our interventions and things that you'll see throughout nursing will fall back on this somewhat, or those percentages have played a part in those interventions that we do. So there's different variables in healthcare that influence our health beliefs and our practices. Health beliefs, again, like I say, are a person's ideas and attitudes about health. These beliefs often directly influence our practices, whether there's evidence to support them or not. So this might be something like an old wives' tale, say something that you've always heard, that, I don't know, you give catnip to a baby to help them sleep. That might be something you think is a good health practice to do, because that's what you've always heard and been told to do, but there's not any evidence to support that. But like I said, that belief can still influence your practice. Health practices are those activities that individuals perform to care for themselves. And again, many variables can influence this. Understanding of the effects of these variables can help us plan and deliver individualized care to our patients. So that might be something you want to think about of your own, what some type of things maybe you've practiced because of how you've believed, or what your thoughts are on health. Some internal variables may depend upon a person's developmental age, because maybe a younger person, may have different thoughts on illness or concept of illness than, say, an older person, for example. Our interventions need to be age appropriate. And intellectual background. A person's beliefs about health are partially shaped, by our knowledge and our education. Like I said, how well educated you are on that. Your past experiences dealing with an illness. Emotional factors. A person's degree of anxiety or stress can influence how they behave. The way a person deals with stressful situations will affect the way they respond to illness. For example, if you have good coping strategies, or, like, say you come down with illness, if you're more effectively able to cope, you may not be nearly as stressed out about, whatever's happening to you. Where if someone is prone maybe to anxiety or worrying, or, gets excited or worked up over something, then they would respond maybe differently, or they may, I don't know, need more support than someone that, has effective coping skills. And then, of course, spirituality, that's reflected in how a person lives their life. This can include their values, their beliefs, their personal relationships, the ability to find hope and meaning in life. Spiritual health often motivates, is a motivator for times of change of a health status. Usually people that have some type of spiritual belief tend to cope better with changes in their health. And then external variables can affect a person as well. Family practices can be passed down. Again, this can be positive or negative. So like, for example, if you were raised in a family where they believed it was important to go see the dentist twice a year, and have checkups and cleanings and x-rays, then as you get to be an adult, that's a practice that you're more apt to continue. You'll continue the benefits of that. Whereas if you had been someone that was never an important thing, you never went to the dentist, you only went if you were in pain, or you had a real issue that you needed to go, then that preventative care is probably not something that you're going to do when you grow up, or pass on down to your children, for, perhaps. Also, if you had parents that like maybe were unhealthy with their diet, and maybe didn't encourage exercise and healthy eating habits, then that may be something that you continue on into adulthood and that you pass on down to your children. Socioeconomic factors can also influence a person's ability to make hard decisions. For example, if you have a low income, you're barely making ends meet, and you've got to decide between, and I see this a lot, and it's really sad in like the elderly, but if you've got to decide between, do I buy groceries or do I buy my medications, then a lot of times, groceries is going to take precedence over, the prescription drugs, or, maybe somebody needs to be on a special diet. And I see this too, which is sad. A lot of times healthy foods, the more fresh fruits and vegetables and things are more expensive, and they don't last as long. And, if you have a limited budget, you're more apt to buy like the processed foods, canned foods, because they last longer, or, you can stretch them out longer. They don't go bad before you have a chance to eat them. And so you see that a lot as well. We know from experience that culture influences beliefs, values, and customs. So we need to be aware as healthcare providers of the diverse cultures that we may encounter. We need to plan accordingly if we, want them to be compliant. So we need to understand the different cultures and what their beliefs are and where they're coming from. And if we don't understand, we need to ask questions and to investigate, and we need to study. Quick quiz. After evaluating a patient's external variables, the nurse concludes that health beliefs and practices can be influenced by emotional factors, intellectual background, developmental stage, or socioeconomic factors. And that would be socioeconomic factors. Okay, health promotion activities can be either passive or active. Passive strategies of health promotion, individuals gain from the activities of others without acting themselves. But with active strategies, the individual has to adopt those specific programs themselves. For example, like a passive health strategy is the fact that we all are drinking water with fluoride in it, because it's already been added, to our drinking water by the city, and it's there. It's passive. We didn't have to actively do anything to receive that health benefit. For example, same thing, we buy milk at the grocery store. Well, it's already been fortified with vitamin D. So we're getting that benefit without anything we had to do. But now if we choose to go on a diet and lose weight, then that's an active form. If we're smokers and we decide to stop smoking or take a smoking cessation class, and that's an active thing that we've done. We've stepped out on our own and had to make an active effort to do that. We need to emphasize health promotion and wellness strategies and illness prevention in healthcare, because that can help patients maintain and improve their health. Some health promotion activities like a exercise routine, good nutrition, these can help patients maintain or either enhance their levels of health. And again, this can reduce certain risk for certain diseases. Wellness education teaches people how to take care of themselves in a healthy way. A lot of times this can include physical awareness, stress management, self-responsibility. And then illness prevention can be like your immunization programs. This actually protects patients from actual or potential threats of health. These health promotion things, those can also be, like your routine, your screenings, like your colonoscopies and mammograms and that type of thing. Improving self-management and providing preventative services can ultimately reduce healthcare costs and healthcare needs. Because like we talked about before, if you can stay healthy to begin with and not have to go into the hospital or have procedures or be on multiple medications and that type of thing, all of those things would reduce your costs. Now, there's 3 levels of prevention. There's primary, secondary, and tertiary. Nursing care directed at health promotion, wellness, and illness undertakes all 3 of these levels. Primary prevention includes our health promotion, our wellness education programs, our immunizations, hearing protection, for people that are in jobs that they have loud noises and they have to wear the hearing protection. Developing the good body mechanics, when we're getting training for that, that's part of primary prevention. And again, the health screenings like for prostate, breast cancer, colon cancer. Secondary prevention is provided in the home or a home health care agency or a skilled nursing facility. These are screening techniques and treating early stages of disease to help limit the disability or delay the consequences of advanced disease. Tertiary prevention, this helps patients achieve as high a level as they can of functioning. It's called preventative care because it involves preventing further disability or reduced functioning. We got another quick quiz. You will use the concept of primary prevention when when instructing a patient to A, get a flu shot every year, B, take blood pressure reading every day, C, explore hiring a patient with a known disability, D, undergo physical therapy following a cerebrovascular accident. And that would be A, to get your flu shot every year. Now, risk factors threaten health, influence health practices, and are important considerations in illness prevention activities. A risk factor can be a situation, a habit, social or environmental condition, physiological or psychological condition, development or intellectual condition, spiritual condition, or any other variable. Genetic and physiological factors such as being overweight can affect the physical functioning of the body. Age also increases susceptibility to certain diseases. Can you all think of ways that age can increase risk? If you think about it, most diseases, the incidence of it increases as you age. There's higher incidence of cancer, dementia, Alzheimer's disease. All of those increase, the risk of acquiring those increase as you age. Environment includes cleanliness, heat, cold, overcrowding, and air quality. Lifestyle contains those factors that have positive or negative effects on health. Like I said, there's a lot of things with lifestyle that's a risk factor. Smoking is a big one. Sunbathing, that puts you at increased risk for skin cancers. Poor nutrition. If you participate in risky behaviors, even risky recreational activities, like if you're mountain climbing or skydiving, that puts you at increased risk of, an incident. But some factors that are positive, seatbelt use, if you're wearing a seatbelt, wearing a helmet when you ride a motorcycle or a bicycle, those are some healthy lifestyle factors. The goal of risk factor identification is to help these patients understand those areas in their life that they can modify or get rid of, change to help promote wellness or prevent illness. So like, if you're a smoker, then, this is something that they need to eliminate to promote wellness and prevent illness. So you will perform health risk appraisals when you're in the healthcare setting, and these forms usually will estimate health risk based on certain behaviors, and then we'll need to link findings from that health risk appraisal with educational programs. So for example, like I keep using smoking, I know, but that's just what I think of right off, but at Lake Cumberland Hospital, when you admit someone, it automatically comes up, and if they're a smoker, you have to say yes or no, and if they are, an education form automatically prints out on smoking cessation programs and whether they would be willing to receive more information about that and things like that. So that automatically prints out, from the admission criteria that you put into the computer program. Once you identify risk factors, then we need to implement health education programs that can help a person to change their risky health behavior. And that's called a risk factor modification. So we need to aim our attempts to change the person's behavior at stopping a health damaging behavior or adopting a healthy behavior. Again, if a patient has, a disease that, like a diet related, say they have heart disease, then something might automatically formulate from the computer program about a heart healthy diet, to educate your patients on. There are several programs that are already set up like that. There are stages to change, to behavior change, and they tend to follow this set stages of behavior. They can range from pre-contemplation, like when they really don't have an intention to change, they're not wanting to the maintenance change, when they have changed their behavior and they're maintaining that. Most of the time, people that are trying to change something on their own often don't get through all those changes the first time. There's a lot of times, say, for example, again, with the smoking, a lot of times it's attempted many times before it's successful, or it may even be successful for many years, and then there's a backslide, and they go through these stages again. So at times, an experience with an illness will motivate a person to adopt positive behaviors. Acute and chronic illness are two general classifications of illness. An acute illness is usually short-term and severe. These symptoms appear abruptly, they're intense, but they often subside after a relatively short period of time. So like if you've got, say, strep throat, for example, or something, it comes on fast and furious, but with some medication and all, you're over it quickly. Or um, like I said, the flu, something like that. It's just you get it and it doesn't last a whole long time, but then it's over. But then a chronic illness usually lasts longer than 6 months, and patients fluctuate between maximal functioning and serious health relapses that are sometimes life-threatening. Now, these can be, like congestive heart failure, diabetes, etc. A major role for you as a nurse is to provide patient education that helps patients manage their illnesses or disabilities to reduce the occurrence of symptoms and improve the tolerance of symptoms. This education enhances wellness and improves quality of life for patients living with chronic illness or disabilities. Use a holistic approach when helping patients who have chronic illnesses to manage their care better.